Hello and welcome to WombTube. I'm Rachel from The Healthy Womb, and today I'm joined by Clare Blake from Fertility Massage. Clare is my mentor, but she's also the founder of the Fertility Massage Therapy. She's also a qualified naturopath, and she has a wealth of experience in women's health and reproductive work. So, Clare, welcome and hello.
Hello, and thank you so much for having me.
Thank you for joining me. So let's start at the sort of beginning. I want to find out a bit more about where fertility massage came from and how you ended up working with this population of women.
Okay, well, I've been a body worker for about 15 years, and I've done lots of different training in different countries. I've done lots of travelling. And about 8 years ago, I learned abdominal sacral from a lady called Helen Rolicek. And the first time I ever experienced it, I absolutely loved it. And I started working with that and I realised I'm a very playful person. When I massage, I'm very playful. So I wanted to just play with what I was learning and use my own intuition. So I brought in abdominal sacral, but then other techniques such as pulsing, which is the Tai Chi of massage. It's derived from Tibetan and Hawaiian therapies and comes together. And it's a very gentle, it's a rocking, it's a rhythmic movement. It takes you back to being into the womb space. And I'd also been a doula for a couple of years and was lucky enough to learn some rebozo techniques from some Mexican midwives. And again, I took the rebozo and the pulsing and brought them together and played around. I was like, oh, this works wonderfully. And certain ceremonies that I learned that was traditionally used for postpartum, I really worked because after working with lots and lots of women over time, you get to know what women need, what women have experienced. And so, it's a culmination of lots of different therapies, lots of different training. I did my naturopathy training in Australia and some massage training in Australia as well. So I learned different techniques from all over and just brought it all together. And it continues every time I teach it. it evolves and changes because suddenly I can go, oh, actually we can bring this in. But it's coming from the depths of my intuition and my womb wisdom.
Wonderful. And I have to say it was life-changing for me.
Thank you.
So today we're talking about period pain, and it is one thing that fertility massage has such a huge help for. So I was wondering if you could sort of explain the mechanics of what can cause period pain and how the massage can help.
Certainly. Well, I'll get my trusty room out.
Mm-hmm.
Within our pelvis, we've got lots of ligaments. We've got 4 ligaments that hold our womb in place. We've got 2 ligaments that hold our ovaries in place. Now, anatomically, if our womb is sitting in the right place and everything is perfect, she's sitting just above the bladder, slightly forwards and not leaning backwards on the rectum, and she's sitting central. However, due to our lifestyle factors, things like wearing high heels and tilting our pelvis forward all the time, or carrying a child on one hip and having our pelvis tilted, incorrect seating posture, heavy running, gymnastics, things like that we do, especially in the lead up to our period. They're all detrimental to the health of our pelvis because they change the habitual changes of how our pelvis is sitting. And if our pelvis isn't sitting in a good anatomical place, it also changes how our womb sits inside. And so when our womb is maybe leaning forwards, I can't really see. There, perfect. The floppy womb there is perfect. When it's sitting forwards in an anti-flex or anti-verted position, or it's backwards in a retroverted or retroflex position, it's going to be leaning on either the bladder forwards or the rectum behind, or even the spine behind. Sometimes she can also be leaning to the left or to the right. And so wherever she's sitting, she is going to be causing congestion on that side of the body, but she's also going to be pulling on the ligaments on the other side. So if she's sitting to the right side will be congested, and the left side, the ligaments are going to be overstretched, and there will be restrictions in the movement. Now, our womb should be able to move around backwards and forwards, but a lot of us, we have these habits, we continue these habits time after time, and our womb ends up being adhered to one of these positions. And so it's being in that kind of position that as she expands, so when she's non-menstruating, she's 1 to 2 ounces. When we are menstruating, she's about 2 to 4 ounces, roughly. If we've got pathologies like fibroids, she goes up to about 8 ounces. So when she's increasing in that weight, and she's not sitting in a good place, she's either going to be putting more pressure on the bladder, more pressure on the rectum, or more pressure on those ligaments. So that's going to cause period pains. And again, if she's not sitting upright, she's got to squeeze harder, she's got to contract harder to get that blood flow, get your squidgy womb. She's got to squeeze harder. And you see that area there where it's pooling. That's where we get the brown blood. So we get brown blood at the beginning of a cycle, brown blood at the end of a cycle. That brown blood at the beginning is last month's old lining. Brown blood at the end of a cycle is months and months old lining. And it's just showing that our womb is not releasing and shedding that endometrial lining. So when she has to contract harder because she's not sitting in an upright place, she's pulling on those ligaments. She's squeezing harder. And that is going to cause those period pains. But there's also the fact as well, energetically, if we think about if we're not honouring our cycles, if we're not honouring the fact that we have this menstruation, we try to block it out with taking Nurofen and I can't remember the other medications because I don't take them. The medications that we take
usually.
What was the one?
Paracetamol.
That's the one, thank you. Paracetamol. When we take paracetamol, we dumb it down. We're not feeling our bodies, and we think, we can still keep going through our cycles. And actually, we can't. We need to slow down, and we need to honour our periods. So, that's the structural and the very brief bit about the energetics of period pains, really.
Wonderful.
You want to add anything to that, Rachel?
No, I think you've pretty much covered it all without going into too much detail, which is what I tend to fall down on. So, moving on then to the massage.
Yeah.
How can that help with those?
Okay, so with the massage, we work on the sacrum and the lower back because the ligaments and that run from the back of the sacrum, they wrap around the uterus. Got the uteral sacral ligament. You can see, as you can see, from the trusty pelvis. You also have the nerves that feed through from the lower back of the sacrum that feed directly through into the reproductive and the digestive organs. So they go through those little holes there that Rachel's pointed out, the foramen. They feed through those. So we want to work that lower back area. So we are firing up those nerves and getting them to be as connected as possible and actually and have as much circulation as possible. And then when we're working on the front, we're working from the pubic bone up to the rib cage. We're working that whole abdominal torso. And the work that we're doing is about increasing the circulation down into the womb area. We get 5% blood flow to our womb, and that's if there's no restrictions. So when there are restrictions, we've got even less, and so we get a lot of women with what's known as a cold womb or a cold uterus, and it's stagnation. So we want to get that increased circulation, but we also work up by the diaphragm, and so by helping to stretch and open up that diaphragm, because most of us in the Western world, we shallow breathe. And so we forget to breathe all the way down into our abdomen. So when we shallow breathe in, we are allowing that diaphragm, bring that diaphragm in to tighten up. And the aorta, which is the big artery that brings all the blood down into the abdomen, that's constricted as well. So by using that diaphragm work, we're opening it up, we're bringing as much circulation down through the upper into the lower abdomen. So we're feeding the whole of that torso with lots of circulation. We do a lot of pulsing work. I talked about pulsing just a minute ago, the rocking. We do a lot of pulsing. It's really hard to hold on when you're being rocked. You can't hold on. But because of the rocking, even though I may just be rocking at your hip, the whole way from your toes up to your head has a gentle movement, and that's the fascia. We have fascia, which is like a big sheet that wraps all the way around our muscles and organs, and it wraps all the way from toes to head. So by the gentle rocking, it's allowing all that fascia to gently, it's like a wave, just kind of gently opening up and allowing to relax, and it allows for the movement of the organs within the body to come back into a good place. So the massage is very gentle. It's very, very nurturing, very feminine. There's no point. It's amazing the amount of clients that say, I expected it to be really quite painful because you're working my abdomen. And And it doesn't have to be. You do not need to go deep or painfully deep for it to be effective. Gentle work, using rocking, using a lot of energy fascia work, it's very, very powerful. And so our work is, our massage is very much like a dance as well. We're working with the rhythm of the person receiving. It feels so beautiful to give and to receive as well. And you just kind of float off with it.
Yes, I do too. And I also have the thing where most of my clients say, I'm really surprised it was so gentle, and they can't believe that it wasn't too painful.
Yeah, it's sometimes we need to remember as well the simple things are the most effective, and sometimes just that holding or very gentle, rocking work is much more powerful. I know it's like when you have a back massage and they kind of get their elbow in, no pain, no gain. All our body does is just go and seizes up. So, it's a beautiful, beautiful treatment.
And the other thing as well, it's really nice actually having a nurturing touch around your tummy area, because it's one area that's hugely neglected in our culture.
Yeah, and so many people are like you say, they don't touch their own abdomens, and most women, we don't like our bellies being on show, because if we don't look like Kate Moss, then we kind of think we're not womanly, but we are womanly, because I love bellies.
I do too.
Bellies are good, especially when you can get in and have a good, when you do the digestive work and having a good squidging session.
Yes, indeed. It's always good to have a belly to squidge when you're working on a lady. I find. And the other thing it's worth pointing out too as well is we teach women how to work on themselves, and you even have an online course, don't you?
Yeah. So when a client comes to see, like myself and any of the practitioners that are trained, they're also taught how to do self-help massage, because we can't see them on a regular basis, can't see them nightly. And so to receive the continuation of those benefits, it's such a good idea for women to know how to massage themselves, but also they get to know and they get to become in tune with their own body, and they get to feel that, what feels right, what doesn't feel right, and they can feel the changes in their body, and that empowers them. But also it's lovely, if a couple are on a fertility journey, get man and wife, or, partners lying next to each other and doing their own self-help, it means that both of them are doing the journey together, and they're both improving their digestive system and their reproductive system together. But yeah, then you feel like you're doing something for yourself. It's all about self-love.
It is.
Just taking that 5 minutes. So yeah, and there is, like you said, there is an online program. If you can't actually physically get to see myself or one of the practitioners, there's an online program that talks you through step by step, and guides you through how to do it yourself.
Wonderful. I have to say that's one of the biggest things that I continue doing for myself is the self-care.
Yeah, we do. We need to remember to do it for ourselves as well.
Big time. Yeah. Okay, so if someone's interested in fertility massage, where can they find a practitioner?
Okay, so if you go on to my website, which is fertilitymassage.co.uk, you'll see one of the tabs that says practitioners, and if you click on the country that you're looking for, and within that country you'll find the counties or the suburbs, depending on which country you're looking at. And yes, you can find practitioners on there. Some of them are still students, and it will still state that they're students, and the rest of them are all fully qualified. So we've got 100 odd practitioners in the UK and Ireland, and 45 in Australia. Not everybody's got their names on the website yet, because I'm still waiting. But if you can't find someone close to you, feel free. You can email me, and that's info@fertilitymassage.co.uk, and I will help you find the nearest practitioner to you.
And we've got a few scattered elsewhere, like Canada and the Netherlands. And
we've got one in Canada, 2 in Netherlands. I think about the other one is
somewhere.
Somewhere.
Wonderful. And if someone's interested in doing the practitioner training, what is their prerequisites there?
Okay, they need to have level 3 anatomy and physiology, and that is usually combined with a bodywork skill. So if you are, I'm accredited in the UK with FHT and CTHA, and in Australia with AAMT. So if you are accredited with FHT and you want to go under their accreditation, you must have a level 3 massage qualification and the AMP. And if you're under CTHA, then you can have a reflexology nutritionist naturopath, any kind of body work or any of the natural medicine, as long as you've got the anatomy and physiology. You don't always need to have the massage qualification, because sometimes if you have this love and the passion for working with women's body, then it comes through your hands anyway.
Very true.
But you can always email and have a chat.
Wonderful. And that's all on the same website too?
It is indeed, yes.
Brilliant. Claire, thank you so much for your time. It's been wonderful chatting to you. And if anyone is experiencing period pain, I really do strongly suggest looking for a practitioner in your area, because it's always worth having a quick chat to see if it can help you.
Yeah. Thank you, Rachel.
Thanks.